Let's dive right in. Question 1. A 3-year-old with epiglottitis is admitted with inspiratory stridor and drooling. Which nursing action is the priority? A. Obtain a throat culture. B. Prepare for intubation. C. Start 4 fluids. D. Give oral antibiotics. Correct answer, B. Prepare for intubation. Rationale. Epiglottitis causes airway obstruction. Any throat manipulation can trigger complete blockage. Airway protection through intubation is the immediate priority. Strategy. When a child presents with drooling, stridor, and tripod position, do not examine the throat. Always prepare for airway management first. Question 2. A 5-year-old with nephrotic syndrome is receiving prednisone. Which finding indicates the medication is effective? A. Protein in urine. B. Decreased edema. C. Increased weight. D. Elevated blood pressure. Correct answer, B. Decreased edema. Rationale. Prednisone reduces protein loss in urine and inflammation, leading to improved fluid balance and decreased swelling. Strategy. To evaluate therapy in nephrotic syndrome, monitor edema and urine protein levels, not just weight changes. Question 3. A nurse is caring for a 7-year-old with cystic fibrosis. Which nursing action is most important before meals? A. Encourage fluids. B. Give pancreatic enzymes. C. Offer milk. D. Encourage deep breathing. Correct answer, B. Give pancreatic enzymes. Rationale. Pancreatic enzymes help digest nutrients and must be given before meals to ensure proper absorption. Strategy. For cystic fibrosis, remember, airway clearance and nutrition are top priorities. Question 4. A 6-year-old child with leukemia develops a fever of 102 degrees Fahrenheit 38.9 degrees Celsius. What should the nurse do first? A. Administer acetaminophen. B. Notify the healthcare provider. C. Sponge with cool water. D. Recheck the temperature in 30 minutes. Correct answer, B. Notify the healthcare provider. Rationale. Fever in a child with leukemia suggests infection or sepsis due to low immunity. Immediate medical attention is required. Strategy. Fever in an immunocompromised child equals emergency. Do not delay by giving antipyretics first. Question 5. A nurse is caring for a newborn with suspected congenital heart disease. Which sign should alert the nurse to potential hypoxemia? A. Heart murmur. B. Circumoral cyanosis when crying. C. Bounding pulses. D. Warm extremities. Correct answer, B. Circumoral cyanosis when crying. Rationale. Cyanosis during crying or feeding indicates poor oxygenation, often linked to congenital heart defects. Strategy. Watch for cyanosis, poor feeding, and tachypnea in newborns as early cardiac warning signs. Question 6. A 10-month-old with dehydration due to diarrhea is prescribed oral rehydration therapy, ORT. Which fluid should the nurse administer? A. Apple juice. B. Oral rehydration solution. C. Plain water. D. Sports drink. Correct answer, B. Oral rehydration solution. Rationale. ORS provides balanced electrolytes and fluids. Juices and sports drinks contain sugar that worsens diarrhea. Strategy. For mild to moderate dehydration, use commercial or WHO-approved ORS only. Question 7. A 4-year-old is scheduled for a tonsillectomy. Which finding should cause the nurse to notify the healthcare provider before surgery? A. White spots on tonsils. B. Cough and runny nose. C. Bleeding gums. D. Low-grade fever. Correct answer, C. Bleeding gums. Rationale. Bleeding gums may indicate a bleeding disorder or low platelets, increasing surgical risk. Strategy. Before surgery, report any bleeding tendency or signs of infection immediately. Question 8. A 2-year-old child with burns over 20% of the body surface area is receiving 4 fluids. Which finding indicates adequate fluid replacement? A. Urine output 1 milliliter per kilogram per hour. B. Capillary refill greater than 4 seconds. C. Dry mucous membranes. D. Decreasing blood pressure. Correct answer, A. Urine output 1 milliliter per kilogram per hour. Rationale. Normal urine output, greater than or equal to 1 milliliter per kilogram per hour, shows good perfusion and hydration. Strategy. In burn patients, urine output is the most reliable indicator of fluid resuscitation adequacy. Question 9. A nurse is assessing a 9-year-old with asthma who is wheezing and using accessory muscles to breathe. What should the nurse do first? A. Administer prescribed albuterol. B. Encourage slow, deep breaths. C. Start chest physiotherapy. D. Obtain a sputum sample. Correct answer, A. Administer prescribed albuterol. Rationale. Albuterol is a bronchodilator that relieves acute airway constriction rapidly. Strategy. In asthma exacerbation, bronchodilator first, then assess response. Question 10. A 15-month-old is brought to the emergency department after ingesting an unknown amount of acetaminophen. What is the nurse's priority action? A. Administer activated charcoal. B. Assess airway, breathing, and circulation. C. Obtain serum acetaminophen level. D. Notify poison control. Correct answer, B. Assess airway, breathing, and circulation. Rationale. Always stabilize airway and breathing before interventions or antidotes. Strategy. Follow ABCs first in poisoning or overdose scenarios. Question 11. A 6-year-old with sickle cell crisis reports severe leg pain. The nurse's priority action is to A. Apply ice packs. B. Restrict fluids. C. Administer prescribed opioid analgesic. D. Encourage ambulation. Correct answer, C. Administer prescribed opioid analgesic. Rationale. Pain during sickle cell crisis is due to vaso-occlusion. Opioid analgesics relieve pain and reduce stress, which decreases sickling. Strategy. Always treat pain and promote hydration during sickle cell crises, pain relief first, then fluids. Question 12. A 1-year-old has been diagnosed with iron deficiency anemia. What should the nurse recommend to the parents? A. Switch to whole milk. B. Offer more citrus fruits. C. Provide iron-fortified cereal. D. Give more water. Correct answer, C. Provide iron-fortified cereal. Rationale. Iron-fortified cereals are the best source of dietary iron for infants transitioning from formula or breast milk. Strategy. Avoid excessive milk, it reduces iron absorption and may cause anemia. Question 13. A 9-month-old infant is admitted with bronchiolitis. Which intervention has the highest priority? A. Administer 4 fluids. B. Suction the nasal passages. C. Provide antibiotics. D. Encourage oral intake. Correct answer, B. Suction the nasal passages. Rationale. Infants are nose breathers, nasal obstruction increases respiratory distress. Strategy. In respiratory illnesses, maintain airway patency first, suction before feeding or oxygen delivery. Question 14. A nurse is assessing a child after cardiac catheterization. Which finding requires immediate intervention? A. Slight bruising at the puncture site. B. Weak pedal pulse on the affected side. C. Small dressing with scant bleeding. D. Warm extremities. Correct answer, B. Weak pedal pulse on the affected side. Rationale. A weak or absent pulse may indicate arterial obstruction or hematoma formation, a serious complication. Strategy. Post-cardiac cath, monitor distal pulses and cite bleeding frequently. Question 15. A 2-year-old with meningitis is irritable and sensitive to light. Which action should the nurse perform first? A. Obtain blood cultures. B. Keep the room quiet and dimly lit. C. Administer antipyretics. D. Start 4 antibiotics. Correct answer, B. Keep the room quiet and dimly lit. Rationale. Reducing stimulation decreases intracranial pressure and discomfort. Strategy. Always reduce environmental stimuli for children with meningitis or increased ICP. Question 16. A nurse is teaching parents about preventing sudden infant death syndrome, SIDS. Which statement shows understanding? A. We'll place the baby on his stomach to sleep. B. We'll keep soft toys in the crib. C. We'll put the baby on his back to sleep. D. We'll use a soft mattress. Correct answer, C. We'll put the baby on his back to sleep. Rationale. The back to sleep position significantly reduces SIDS risk. Strategy. Remember the ABCs of safe sleep: alone, back, crib. Question 17. A 7-year-old with diabetes is learning about insulin administration. What action indicates understanding? A. Injecting insulin into the same site daily. B. Rotating injection sites on the abdomen. C. Using expired insulin. D. Shaking the insulin vigorously. Correct answer, B. Rotating injection sites on the abdomen. Rationale. Rotating sites prevents lipodystrophy and promotes consistent absorption. Strategy. Teach older children to self-administer with consistent site rotation. Question 18. A nurse is caring for an infant with pyloric stenosis. Which assessment finding supports this diagnosis? A. Projectile vomiting after feeding. B. Bilious vomiting. C. Watery diarrhea. D. Weak cry. Correct answer, A. Projectile vomiting after feeding. Rationale. Hypertrophy of the pyloric sphincter causes projectile, non-bilious vomiting and hunger after emesis. Strategy. Look for olive-shaped mass and visible peristalsis in pyloric stenosis. Question 19. A 4-year-old with hemophilia falls and injures his knee. What should the nurse do first? A. Apply warm compress. B. Apply cold pack. C. Elevate the leg. D. Massage the area. Correct answer, B. Apply cold pack. Rationale. Cold compresses constrict blood vessels and reduce bleeding. Strategy. For hemophilia, rice, rest, ice, compression, light, elevation. Question 20. A 6-year-old with acute glomerulonephritis has hypertension and edema. What diet modification is appropriate? A. High protein. B. Low sodium. C. High potassium. D. High sodium. Correct answer, B. Low sodium. Rationale. Low sodium diets help reduce fluid retention and control blood pressure. Strategy. In renal disorders, restrict sodium and fluids as prescribed. Question 21. A 12-year-old with scoliosis is fitted with a brace. What should the nurse include in teaching? A. Wear it only at night. B. Wear it for 18 to 23 hours a day. C. Remove it for short walks. D. Apply lotion under the brace. Correct answer, B. Wear it for 18 to 23 hours a day. Rationale. Consistent brace wear prevents curve progression. Skin should be checked regularly. Strategy. Teach skin care, wear a cotton t-shirt underneath, never lotion. Question 22. A 2-year-old is hospitalized for dehydration due to vomiting. Which lab result requires immediate action? A. Sodium 138 milliequivalent/L. B. Potassium 2.9 milliequivalent/L. C. BUN 12 mg per deciliter. D. Glucose 80 mg per deciliter. Correct answer, B. Potassium 2.9 milliequivalent/L. Rationale. Hypokalemia can cause cardiac dysrhythmias. Strategy. Monitor electrolytes closely in vomiting and dehydration, potassium is critical. Question 23. A 3-year-old with autism is admitted for a procedure. Which intervention will best reduce anxiety? A. Assign the same nurse when possible. B. Allow multiple caregivers to interact. C. Change the room daily. D. Force eye contact during communication. Correct answer, A. Assign the same nurse when possible. Rationale. Children with autism need consistency and minimal environmental changes. Strategy. Provide predictable routines and consistent caregivers. Question 24. A nurse is caring for a child receiving 4 chemotherapy. Which action is most important to prevent infection? A. Encourage oral hygiene twice daily. B. Maintain strict hand hygiene. C. Restrict visitors under age 12. D. Limit fresh fruits. Correct answer, B. Maintain strict hand hygiene. Rationale. Hand hygiene is the single most effective infection prevention measure. Strategy. Always choose handwashing as a top infection control action unless otherwise stated. If you're enjoying this video so far, like and subscribe. Welcome back. Question 25. A 9-year-old is diagnosed with type 1 diabetes. Which statement by the parent requires further teaching? A. My child can self-monitor blood glucose. B. We will adjust insulin for exercise. C. He can skip insulin if he doesn't eat. D. We'll keep glucose tablets available. Correct answer, C. He can skip insulin if he doesn't eat. Rationale. Children with type 1 diabetes require basal insulin regardless of food intake. Strategy. Correct misconceptions. Never omit insulin entirely in type 1 diabetes. Question 26. A nurse is assessing a child with suspected appendicitis. Which finding should be reported immediately? A. Nausea. B. Sudden relief of pain. C. Anorexia. D. Low-grade fever. Correct answer, B. Sudden relief of pain. Rationale. Relief of pain may indicate appendix rupture, a surgical emergency. Strategy. Watch for peritonitis signs, rigid abdomen, tachycardia, rebound tenderness. Question 27. A 5-year-old with asthma is prescribed a metered dose inhaler, MDI, with a spacer. Which teaching is correct? A. Inhale quickly and shallowly. B. Rinse mouth after inhalation. C. Use without shaking the canister. D. Hold breath for 2 seconds after use. Correct answer, B. Rinse mouth after inhalation. Rationale. Rinsing prevents oral fungal infection, especially with corticosteroid inhalers. Strategy. Teach shake, inhale, hold, rinse for MDI technique. Question 28. A newborn with jaundice has a total bilirubin of 18 mg per deciliter. Which intervention is the nurse's priority? A. Begin phototherapy. B. Start 4 fluids. C. Administer vitamin K. D. Increase feeding interval. Correct answer, A. Begin phototherapy. Rationale. Phototherapy breaks down bilirubin and prevents kernicterus. Strategy. Monitor temperature, cover eyes, and encourage feeding to promote bilirubin excretion. Question 29. A 10-year-old with rheumatic fever develops chorea, involuntary movements. What should the nurse do? A. Apply restraints. B. Reassure parents this is temporary. C. Request psychiatric consult. D. Reduce physical activity. Correct answer, B. Reassure parents this is temporary. Rationale. Chorea is a temporary neurological symptom that resolves with treatment. Strategy. Educate families to expect temporary movement issues with rheumatic fever. Question 30. A 13-year-old with type 1 diabetes becomes pale and diaphoretic during class. What is the first nursing action? A. Give half a cup of fruit juice. B. Notify the healthcare provider. C. Administer regular insulin. D. Check urine for ketones. Correct answer, A. Give half a cup of fruit juice. Rationale. Classic hypoglycemia symptoms require fast-acting carbohydrates. Strategy. Follow the 15-15 rule, give 15 g carb, recheck glucose in 15 minutes. Question 31. A 4-year-old with a new tracheostomy accidentally removes the tube. What should the nurse do first? A. Call for help. B. Attempt to reinsert the tracheostomy tube. C. Use the obturator to open the stoma. D. Ventilate with a bag valve mask over the stoma. Correct answer, D. Ventilate with a bag valve mask over the stoma. Rationale. Maintain oxygenation while help and equipment are prepared. Strategy. Always ensure oxygenation first before attempting reinsertion. Question 32. A nurse notes a 6-year-old with nephrotic syndrome has gained 2 kilograms in 2 days. What should the nurse do? A. Restrict protein. B. Notify the provider. C. Encourage ambulation. D. Increase fluids. Correct answer, B. Notify the provider. Rationale. Rapid weight gain indicates worsening fluid retention and relapse. Strategy. Daily weights are the most reliable indicator of fluid status. Question 33. A 9-year-old with acute rheumatic fever is prescribed penicillin. What is the most important nursing action? A. Check for history of seizures. B. Ask about allergies to penicillin. C. Encourage fluid intake. D. Monitor urine output. Correct answer, B. Ask about allergies to penicillin. Rationale. Allergy assessment prevents severe anaphylactic reactions. Strategy. Always verify drug allergies before giving antibiotics. Question 34. A 3-year-old with diarrhea is prescribed oral rehydration therapy. Which finding indicates the therapy is effective? A. Dry mucous membranes. B. Sunken fontanelle. C. Tears present when crying. D. Lethargy. Correct answer, C. Tears present when crying. Rationale. Presence of tears and moist mucous membranes indicate adequate hydration. Strategy. Assess clinical hydration signs, urine output, tears, moist lips. Question 35. A 5-year-old with chickenpox is scratching lesions. Which intervention is most appropriate? A. Apply antibiotic ointment. B. Keep fingernails short and clean. C. Cover lesions with adhesive bandages. D. Apply alcohol to dry lesions. Correct answer, B. Keep fingernails short and clean. Rationale. Short nails prevent secondary infection from scratching. Strategy. Focus on infection prevention and comfort for viral rashes. Question 36. A 2-year-old child is being discharged after treatment for lead poisoning. Which statement by the parent indicates correct understanding? A. I'll let my child play in the garden soil. B. We'll wash hands before meals and after play. C. I'll store food in opened metal cans. D. I'll stop giving milk for a few weeks. Correct answer, B. We'll wash hands before meals and after play. Rationale. Handwashing prevents ingestion of lead from contaminated surfaces. Strategy. Educate on lead sources, paint, dust, soil, and hygiene measures. Question 37. A nurse is caring for a 10-year-old with acute asthma attack. Which assessment finding indicates worsening condition? A. Wheezing. B. Decreased wheezing with no air movement. C. Restlessness. D. Use of accessory muscles. Correct answer, B. Decreased wheezing with no air movement. Rationale. Silent chest, no air movement, means severe obstruction, respiratory failure risk. Strategy. In asthma, absence of wheezing is a late, dangerous sign. Question 38. A 1-year-old with gastroesophageal reflux, GER, often regurgitates feedings. What should the nurse teach the parents? A. Feed in a flat position. B. Place the infant in a prone position. C. Keep the infant upright after feeding. D. Give large frequent meals. Correct answer, C. Keep the infant upright after feeding. Rationale. Upright positioning helps reduce reflux and aspiration risk. Strategy. For GER, small, frequent feedings and upright posture. Question 39. A child with spina bifida is admitted for surgery. Which nursing action is a priority preoperatively? A. Keep the sac dry. B. Place the infant in a prone position. C. Cover the sac with dry gauze. D. Apply lotion to the sac. Correct answer, B. Place the infant in a prone position. Rationale. Prone position prevents pressure and sac rupture. Strategy. Keep moist sterile dressing and prone position before repair. Question 40. A 4-year-old receiving digoxin has a heart rate of 80 bpm. What should the nurse do? A. Administer the medication. B. Hold the dose and notify the provider. C. Give half the prescribed dose. D. Recheck after 30 minutes. Correct answer, B. Hold the dose and notify the provider. Rationale. Digoxin is withheld if heart rate 90 to 110, infants/children. Strategy. Always check apical pulse before digoxin administration. Question 41. A 6-month-old with bronchiolitis is irritable, with nasal flaring and grunting. Which is the priority nursing action? A. Provide small frequent feedings. B. Administer bronchodilator. C. Elevate head of the bed. D. Suction the nares. Correct answer, D. Suction the nares. Rationale. Clearing secretions improves breathing in infants who are obligate nose breathers. Strategy. Airway clearance always comes before feeding or medication. Question 42. A nurse teaches parents how to administer ear drops to a 2-year-old. Which statement shows correct understanding? A. I'll pull the ear up and back. B. I'll pull the ear down and back. C. I'll drop the medicine onto the eardrum. D. I'll warm the drops in the microwave. Correct answer, B. I'll pull the ear down and back. Rationale. For children under 3 years, pull pinna down and back to straighten the ear canal. Strategy. Remember, under 3 down and back, over 3 up and back. Question 43. A nurse observes a 7-year-old with seizure disorder suddenly staring blankly for 10 seconds. What should the nurse do next? A. Call for help. B. Document the event. C. Begin CPR. D. Insert airway. Correct answer, B. Document the event. Rationale. This is an absence seizure, brief and harmless, requiring documentation only. Strategy. Always observe, time, and document seizure characteristics. Question 44. A 5-year-old with a cast on the left leg reports severe pain despite medication. What should the nurse do first? A. Reposition the leg. B. Assess for swelling and tightness. C. Apply warm compress. D. Notify the provider immediately. Correct answer, B. Assess for swelling and tightness. Rationale. Pain unrelieved by medication may indicate compartment syndrome. Strategy. Always assess neurovascular status, 5 PS, with casts. Question 45. A 10-year-old receiving chemotherapy reports mouth pain. What is the best nursing action? A. Encourage orange juice intake. B. Provide soft, bland foods. C. Use mouthwash with alcohol. D. Offer salty snacks. Correct answer, B. Provide soft, bland foods. Rationale. Mucositis causes painful mouth ulcers, bland foods prevent irritation. Strategy. Avoid citrus, spicy, and hot foods during mucositis. Question 46. A newborn is placed under a radiant warmer. Which finding indicates the warmer is effective? A. Skin mottling. B. Axillary temperature 98.5 degrees Fahrenheit 36.9 degrees Celsius. C. Shivering. D. Cool extremities. Correct answer, B. Axillary temperature 98.5 degrees Fahrenheit 36.9 degrees Celsius. Rationale. Normal temperature indicates effective thermoregulation. Strategy. Monitor axillary temp, not rectal, in newborns for accuracy and safety. Question 47. A nurse is preparing to administer a vaccine to a toddler. What is the most appropriate site? A. Deltoid muscle. B. Ventrogluteal muscle. C. Vastus lateralis muscle. D. Dorsogluteal muscle. Correct answer, C. Vastus lateralis muscle. Rationale. The vastus lateralis, thigh, is the preferred AIIMS site for infants and toddlers. Strategy. Avoid dorsogluteal site, risk of sciatic nerve injury. Question 48. A 14-year-old with depression states, "I wish I could go to sleep and never wake up." What should the nurse do first? A. Ask if the child has a plan for suicide. B. Notify the school counselor. C. Encourage journaling. D. Stay with the child and offer reassurance. Correct answer, A. Ask if the child has a plan for suicide. Rationale. Directly assessing suicidal intent is essential for safety planning. Strategy. Always assess intent and plan before taking further actions. Question 49. A 3-year-old with croup presents with barking cough and inspiratory stridor. Which action is appropriate? A. Provide cool mist therapy. B. Give cough suppressant. C. Place in supine position. D. Offer ice-cold fluids. Correct answer, A. Provide cool mist therapy. Rationale. Cool mist reduces airway inflammation and eases breathing. Strategy. Avoid throat inspection or agitation in croup, airway priority. Question 50. A 6-year-old is admitted for rheumatic fever. Which statement by the parent indicates understanding of long-term care? A. Will stop antibiotics after 2 weeks. B. He will need monthly penicillin injections. C. He can resume sports next week. D. Once symptoms resolve, we don't need follow-up. Correct answer, B. He will need monthly penicillin injections. Rationale. Monthly prophylactic penicillin prevents recurrence and heart valve damage. Strategy. Emphasize long-term antibiotic prophylaxis and regular follow-up for rheumatic fever. Congratulations, you've just completed 50 brand new, high-level pediatric NCLEX questions with answers, rationales, and strategies. Each question was designed to sharpen your critical thinking, prioritization, and nursing judgment, the exact skills you need to pass the NCLEX with confidence. If you found this helpful, don't forget to like, comment, and share your score below. Challenge yourself and others to beat it next time. Subscribe for more real NCLEX-style practice on every nursing topic, from OB to Med-Surg to pharmacology. Remember, practice, review, and rationales are your 3 keys to success. Keep going, your RN dream is within reach.